She was training to save lives. She knew how to manage pain, calm patients, and stay strong under pressure. But one day, pain chose her instead. Her muscles began to freeze, suddenly, violently, without warning. Not from injury, not from overwork, but from something no one around her could see. This is the true medical mystery of a young woman whose body turned against her and destroyed her nursing career before it even began. She was 22 years old, healthy, athletic, motivated. Nursing was not just a job for her, it was a calling. Long shifts didn't scare her. Stress didn't break her. She believed pain was something you treat, manage, control. She never imagined pain could control you. Her classmates described her as focused and disciplined. Her instructors trusted her with responsibility early on. Everything was going exactly as planned, until her body began sending signals she didn't understand. The first episode happened during a routine clinical shift. She felt a sharp tightening in her legs. At first, she thought it was dehydration, then fatigue. But within minutes, her muscles locked in place. Her legs refused to move. The pain spread like electricity through her body. She collapsed, fully conscious, unable to control her own muscles. Her hands curled inward. Her jaw tightened. She could hear people talking, but she couldn't respond. Doctors ran tests, blood work, scans, neurological exams. Everything came back normal. Some suggested anxiety. Others blamed stress. One even hinted it might be in her head. She was sent home with painkillers and reassurance. But the episodes returned, stronger, longer, more frequent. Each time, her muscles froze with unbearable pain. Each time, she felt her dreams slipping further away. Eventually, a specialist recognized the pattern. She was diagnosed with a rare neurological condition involving abnormal muscle contractions. Her muscles weren't injured. They were receiving faulty signals from the nervous system. When triggered, her body entered a state of intense muscle rigidity, like being trapped inside your own body. Stress, fatigue, even mild emotional pressure could trigger an attack. There was no cure, only management. For a nurse, a job built on physical endurance. This diagnosis was devastating. Clinical rotations became impossible. She never knew when her body would betray her. One frozen episode in a hospital could endanger patients and herself. Reluctantly, painfully, she withdrew from the program. Not because she lacked skill, but because her body refused to cooperate. Watching her classmates graduate felt like mourning a future that would never exist. Today, she lives cautiously. Every movement is calculated. Every plan comes with uncertainty. Physical therapy helps, but doesn't erase the condition. Medication reduces attacks, but never guarantees safety. She learned a painful truth. Being strong doesn't always mean pushing forward. Sometimes it means surviving what you cannot change. Her nursing career ended before it truly began. But her story didn't. She now speaks about invisible illnesses, about how pain doesn't always look dramatic, and how dreams can change without disappearing. Because sometimes the strongest people are the ones who keep going, even when their bodies say no. Not all disabilities are visible. Not all pain is imagined.